If this is your first time at a Safe House Project webinar, this is kicking off our fifth year of the webinar series. So we have 4 years of past webinars that you are able to go back and watch for free. They are on our website under the webinars tab on the right-hand side. They're also on our YouTube, Safe House Project YouTube, but we've been doing these now for our fifth year. So this is exciting. So January starts our fifth year, and I'm really excited to have this conversation specifically. My name is Alia Azariah. I'm the Director of Collective Impact. I just had a title change at the beginning of this year, Director of Collective Impact for Safe House Project. So I have the opportunity to facilitate these webinar series, and our hope with them is never that they are like a comprehensive training on any one topic, but that they are the start of a conversation that we hope you will continue to have with experts like our panelists and other experts as you continue on in this work, and maybe just giving you new opportunity to have those conversations, new people to have those conversations with that are like-minded, that are doing the work in that space, and that can point you towards ongoing training around those things. So that's our point here. It's not to be comprehensive in the information that we provide, and certainly not to say that we as Safe House Project have that information, but to say that as a national org, we're blessed to be able to meet the people that often do and bring those conversations to our other regional and local organizations that want to have those conversations. So that's what we are doing. This webinar specifically is centered on a critical gap that we continue to see across the field and across systems, that human trafficking, and especially sex trafficking, but all forms of human trafficking, is often not treated or responded to as an act of violence, even though it is a qualifying act of violence in many frameworks. And when survivors disclose trafficking to an advocate, they're often routed towards resources without being offered the same health, wellness, and justice options that are routinely available to other victims of similar kinds of violence. And this includes access to medical forensic care. And our goal today is not to go over detailed forensic medical exams or to even tell anybody what they absolutely should do or how they should write their policies, but instead to expand what is possible and what's available and why it should be considered and given as an option. And that will help to ensure that survivors are offered informed choices rather than having those choices unintentionally removed from them before they're able to make an informed choice on their own. So I'm honored to introduce our panelists. I'm going to start with introducing Amanda Pulley. Amanda is a nationally recognized advocate. She's an educator. She is a brain spotting consultant and has more than a decade of experience walking alongside survivors of trafficking and complex trauma. She is also a lived experience expert, and her work is grounded in the belief that survivors are definitely not broken and that healing is absolutely possible. Her approach is shaped by professional training and her own lived knowing. She's collaborated with residential programs, with law enforcement, with child welfare, and community agencies across the country, supporting systems and moving beyond crisis management and toward care that honors survivor autonomy, dignity, and nervous system safety. She also consults with us as a training consultant at the Safe House Project. Through that role, she's developed and delivered evidence-based survivor-centered curricula to elevate the quality of care in anti-trafficking programs. And I would just say anti-trafficking work nationwide. And her work emphasizes neurobiology, relational attunement, and the creation of environments where survivors are not pushed to heal, but supported in reclaiming their own sense of agency and choice. She's also a brain spotting consultant and practitioner, and is just an incredible resource for us at Safe House Project and for so many incredible organizations across the country. So we're glad to have Amanda with us. We also have Melissa Vesperman. She has over 20 years of, oh gosh, I just lost your bio. Excuse me. She has over 20 years of nursing experience with a strong background in labor and delivery of postpartum, medical, surgical nursing, mental health, and forensic nursing. And for the past 12 years, she's served as the forensic nurse coordinator at the St. Croix Valley SART, which is an independent nonprofit sexual assault response team based in River Falls, Wisconsin, and she's held the role of executive director for the last 4 years there. And while her earlier nursing roles were deeply meaningful, she found her true calling in forensic nursing, supporting victims of violence and trauma by promoting healing and recovery, and became a certified as a sexual assault nurse examiner for adults and adolescents in 2014. So we are so grateful to have your medical expertise and practitioner expertise available to us on this call as well, Melissa. And last but not least, we have Annalise Hughes Thompson. She is the Community Outreach and Prevention Education Coordinator at the St. Croix Valley SART. She graduated with a bachelor's degree in public administration and political science, following which she worked for Special Olympics in Minnesota and was a volunteer sexual assault advocate at the Sexual Violence Center in Minneapolis. And in 2016 joined the U.S. Peace Corps as a health education teacher, serving the Republic of Moldova, teaching health education to Romanian students in grades 5 through 9, when she joined St. Croix SART in November 2019, providing direct advocacy support services to survivors of sexual violence. So we're excited to have her advocate lens as somebody who walks alongside survivors through their SANE exam experience here as well. So thanks for joining me, ladies. So happy to have you. So we're going to go ahead and jump into the conversation. And Amanda, I would love for you to start us off because, full disclosure, this conversation was really Amanda bringing this up to me. It's something that I had never really thought of. Obviously, in my head, it was like, of course, sex trafficking specifically is an act of sexual violence, but had no idea that there were resources outside of like advocacy and safe housing, but that medical resources like this were available, or that there were sexual violence resources available to survivors of trafficking. So would love, Amanda, if you could talk about what you've noticed as far as human trafficking not being treated or responded to as violence within systems, and what that gap has looked like in practice. What are we missing? What are we missing if trafficking isn't framed as a qualifying act of violence?
Yeah, what I've noticed over the last 10 plus years is that we all love our check boxes and we all love our frameworks that this is how we define this type of violence, or this is who qualifies for this, right? And in our kindness and wanting to figure out who qualifies for what and make sure they have resources, we've also missed the overlap in those resources at times. And we get stuck in putting people in a box of you qualify for these services. And what I was noticing as an advocate was that the human trafficking advocates, that they were really focused on working with survivors of trafficking, they were not trained in how to walk through a sexual assault exam with a survivor. They didn't even know when to offer one. They didn't have any additional training around what a forensic exam included, and that it was way more than just gathering evidence. And on the flip side of that, when I would talk to sexual assault forensic nurses, or when I was talking to sexual assault advocates, I was noticing that they weren't necessarily as skilled at identifying trafficking. And so really it became a conversation. Annalise and I had a lot of conversations around this, like how do we close this gap? How do we help people recognize? And then even in writing curricula for Safe House Project, amongst our team, we were having conversations where it was just reminding everyone that sex trafficking specifically is sexual violence. And so therefore they qualify under any sexual violence category. And even going further and talking about other violence and the overlap between them. So that's really where it started from, was just recognizing, wait a second, we're missing this somehow. And as a survivor myself, of course, sex trafficking is sexual violence. I remember the first time I brought this up to some of the people within my friend group that are also in this field, they were like, of course it is. And I think what we've done is separate ourselves, because if we're thinking of sexual violence every single day, all day, it feels too heavy. And so we've just separated it out that, yeah, they're trafficked, but that's different. And it's really not. And so I'm excited to have this conversation with all of you and hopefully bridge that gap a little bit.
Yeah, absolutely. Thank you. And I appreciate you bringing this conversation forward. Melissa or Annalise, do you have anything you want to add to what Amanda said?
Yeah, I do, if that's okay. I think oftentimes what we see is that if the victim doesn't necessarily see themselves as a victim, see themselves as a victim of sexual assault or of even trafficking, that it's not necessarily thought of that they would want to go to a sexual assault exam because we treat them like victims, which is not necessarily true. We have plenty of patients that we see that don't want to be seen that way, and so we can offer everything that we can offer, treating them as just a patient in front of us and finding out what their needs are for that exam without pushing reporting to law enforcement or pushing a service that they don't feel is the right fit for them.
Yeah, thank you. Melissa, do you have anything you want to add? Or Annalise, do you have anything you would like to add?
I think these wonderful ladies have covered it. It's just identifying what are the other services and how do we provide that all-encompassing care.
Yeah, thank you. So when trafficking survivors are not offered the responses that are typically available to victims of violence, such as medical forensic exams, what are the potential impacts on survivor health, on trust, and even on long-term engagement with other types of systems of care?
I'll speak to that. So, their impacts on health can be really significant. Are they addressing their risks for sexually transmitted infections, specifically HIV, chlamydia, gonorrhea? Unfortunately, in women, we don't have a lot of signs and symptoms of those infections in our body. So, really being able to either be tested or be medicated preventatively can be very important, especially considering your future health, pelvic inflammatory disease, your ability to carry a healthy pregnancy. All of those things really should be addressed. And then risk for pregnancy as well. Are they on any kind of contraceptive? Do they want to be on any kind of contraceptive? Are they eligible for emergency contraceptive given their circumstances? That, and then oftentimes we see in a patient who is being trafficked, they don't get regular health care. So being able to go in for a medical forensic exam is an opportunity to sit in front of a nurse and talk about other health concerns that we might be able to get you in touch with or address for you and get you on a right path for whatever that health concern may be.
Yeah, see, it's so surprising to me to hear this. Like I'm an advocate, I'm a survivor. I have sat on like trainings around what happens in a SANE exam. And before having the conversation with all of you, I did not know that you could go to a SANE exam for something other than forensic evidence collection. So it's been so interesting.
Yeah, it's a really good point. I think if you're not really familiar with the process of our exam, that's what most people tend to think of is, oh, they're just collecting swabs to do evidence collection. And while that is important to some patients that we see, it is definitely not all that we do. I think a really key part of what we do is build trust within the healthcare system again, because we can take as much time as that patient needs to really listen to them, to really hear them, and address what's most important to them. So sometimes that is STI medications, testing. Sometimes that is pregnancy prevention. Sometimes it's just somebody that they can have a really compassionate ear and tell what has been going on. Sometimes it's just looking their body over and making sure that their body's okay. And it's really important to know with the medical forensic exam, that patient, no matter what their circumstances, no matter what their age, gets to pick what part of the exam is best for them without any pressure, without any judgment. Just knowing their options and being able to be in control is really beneficial to them and can help rebuild some of that trust in healthcare if it was groomed into them not to trust a system.
Thanks, Melissa. Amanda, do you want to add?
Yeah, one of the benefits that I have really loved being able to be a part of is watching the forensic nursing team explain to a survivor what their body is looking like after an assault. That they're okay. That there are so many things, like even as a survivor myself, I went years wondering about my body. And they have such intimate and expertise in understanding anatomy and understanding what the body has experienced. And I know, like, years into doing this work, I went to a forensic nurse conference, or a conference where a forensic nurse was speaking, and she was explaining about just what an exam should be like. And I sat and talked to her for hours afterwards and asking her all the questions that I never got to ask. When I was in my trafficking experience, we weren't talking about these things. And so these were not things that we were offered. And as a kid, when I had a forensic exam, it was a horrible experience. And so to have the healing of having these conversations and seeing the honor to the body, the honor to the survivor, they are truly trauma informed in how they present information. And I think it's so important that we at least offer that if they want to talk to someone and have those explanations, that it's not only just an offering, it is actually their right to have these conversations and understand.
Yeah, absolutely. Annalise.
I would say the one of the best benefits is everything they've already highlighted, right? You're getting that medical care, but having a trained sexual assault advocate there in the room as well, we're not only listening to that exam, but we're working forward in that puzzle piece, looking for additional services, identifying additional needs based on what that survivor is saying and stating during that exam. So as I listen to that exam, I support the survivor, I ensure safety, that we're not looking like we're experiencing trauma or we're disconnecting. My whole job is to watch a survivor during that exam and support them. And so maybe their body language is showing something that their verbal isn't. And I'm working with the nurse as a team member to support that survivor. But I'm also listening for maybe some follow up medical care would be really helpful to you and figuring out where you could receive that, what that would look like, and then knowing who the trauma informed people are to go to or figuring that puzzle piece out, as well as mental health care and other supports and services. And again, having that sexual assault advocate there, treating somebody from that lens of just pure sexual violence, we're identifying some other specifics that are really important in that moment.
Absolutely. So part of this question has already been answered, but I want to make sure that I still ask it just in case there's additional points to be made on it. And it's basically what we've been talking about, that many providers do think that SANE exams are primarily evidence collection. Yeah, what is there anything other than what you've already discussed as far as like STI, pregnancy, assessing for chronic injury or chronic illness or anything like that, that what else can be offered to trafficking survivors outside of evidence collection in a medical forensic exam?
I think one of the biggest overall benefits, especially when we're looking specifically at trafficking victims and the way that they maybe have developed mistrust in systems, mistrust in healthcare, mistrust in law enforcement, anybody that has put them into this position has taught them not to reach out and get help. So if they have that mistrust in healthcare, this is a perfect opportunity to be with a nurse who, like Annalise said, is very trauma informed, or Amanda, very trauma informed, treats them like a person, right? There's no judgment. There's only listening. There's only hearing. We're making sure that their most important needs are addressed by asking them what their most important needs are. And we're really having an opportunity to rebuild that trust in a system that we want them to be able to come back and continue to get help with from, no matter what kind of their journey looks like. Whether they're able to get out of that situation or not, knowing that this place, this kind of exam, is somebody that listened to me and treated me with respect and addressed my needs, and I feel safe going back and talking to them. I think that is the biggest benefit, is rebuilding that trust.
Yeah, absolutely. Amanda or Annalise, do you want to add to that at all?
I think also just taking away, I think there's some stigma around forensic exams that they're sad, they're traumatic, they're really difficult. Taking that away and making medical care itself as stress-free as possible. I can't tell you how many times we've experienced joy in a forensic exam where we were able to give a moment of peace or just relief to somebody, and keeping that peaceful, or even introducing laughter into an exam, because I'd rather laugh than cry. So many forensic nurses are able to provide that for their survivors. Same with their advocates. And that does really demystify some of the difficulties of getting medical care.
Yeah. So you guys have touched on this, y'all have touched on it. And there's a reason that stigma was that there is that stigma, right? Amanda mentioned that she had a really traumatic experience. I had a traumatic experience with a forensic exam as a young teen, and that was the way that things, this is the way that we're talking about things now is not the way things have always been done. And so that's why these conversations have needed to happen, right? Because we have this historical experiences that have not been positive. And Melissa, you've talked quite a bit about having the exams be survivor led and flexible and trauma informed. What does that really look like? Like what are the practical things that make an exam survivor led or trauma informed? What are they allowed to opt out of? How do you ensure that they are being survivor led? And how do you prioritize survivor autonomy through the exam?
Yeah, you bring up a really good point. And I just had a nurse training yesterday that also brought up the same point. When a lot of the nurses 15, 20 years ago were trained, it was almost a training in being an evidence technician. It wasn't necessarily a training in how we nurse them, how we care for them. So I'm very happy that things have come a long way and that we are more trauma informed, and we are focusing on just the evidence collection being one piece of it and not necessarily something that's really important to a lot of the patients that we see. As far as what can they opt out of, quite honestly, everything. We tell them this gets to be your exam. Control was taken away from you in other parts of your life. We want to give it back in any way that we can. If you don't want to tell me what happened, you don't have to. If you want to answer just yes or no questions because you just don't have the ability to go into anything else, absolutely fine. If you don't remember things, if you don't feel comfortable telling me things, that's okay. If you don't want evidence collected, if you don't want to talk to the police, unless it's a situation which is a mandated report, which I can't speak to all those situations because I see we're from all parts of different states, but unless we're talking about a mandatory report, I'm not going to push you to report to law enforcement. I certainly understand all of the barriers to that. If you don't want medications, fine. If you don't want a speculum exam, because frankly, for a lot of women, that part can be very traumatic. We can do things without doing a speculum exam. Nothing has to be inserted into your body if that is not therapeutic for you in this moment. If you don't even want me to look at certain parts, I don't have to. I want to find out in the very beginning of the exam, what is it that you're most concerned about right now, and make sure that's what we're addressing. I'm going to offer you everything else, but I am not going to push you in any way to do those choices. Those choices are completely up to you. And that's really important that we're using language that supports that, not saying, oh, are you reporting to law enforcement? No. Have you thought about, does this path mean you're reporting or not reporting? And if you don't know yet, that's okay. You can make that choice anytime that you want to and give the legal ramifications. So they're making an educated decision, but truly making it feel like it's their own decision and not something I am encouraging them to do.
That's
Does that
amazing.
answer that
That
question?
absolutely answers that question. Thank you
Yeah,
so much,
you
Melissa.
got
Go ahead, Amanda.
I think there's more to this conversation too, in that, yes, they're very helpful in the exam, but they offer so much more. when it comes to the education side, when it comes to working with a very well trained, sane advocate who can also come alongside and has a team of forensic nurses that they partner with, they don't have to always do it at a hospital. A lot of them have centers that they go, that they are able to provide services at. They can do education. They help with so much more than just in this little box of here's your forensic exam and here's things that you can opt in or out of. It gets so much wider when we all work together to meet the needs, because I'm not an OBGYN. And I can't tell you how many times a survivor has asked me, okay, this thing happened, and does that mean I'm scarred for life? Will I always have a scar? Will this always, the next time I'm with a partner, will they know? I can't always answer those questions, right? But if I know a good, sane advocate who works with a forensic nursing team, I can say, you know what, let me set you up an appointment with a forensic nurse and let's get your questions answered. So it's not always these crisis situations where someone was assaulted and we have to hurry up and take them to the hospital. It's also those, I'm concerned and I don't know. I'll be really blunt and honest. There are times I will call the forensic nurses I know and ask questions about my own health because I'm going to get a better answer and it's going to be less traumatizing than going to the OB. They just do such an amazing job. And so I think that's where some of these gaps are, is that we don't recognize there's such a broader scope that when we're working in community as a team, we can partner on some of these things and it doesn't fall on us to know all the answers.
Yeah, and Amanda, you brought up a really good point, right? When we think of forensic exam, or when we think of a medical exam, a sane exam, or access to a forensic nurse, we think immediately after sexual assault, right? That's what we think. That's when we think that when we're able to access those things. And as you just mentioned, that is not always the case. And so I want to dig into a little bit about that, and because there is often this confusion about when somebody can access these exams or what qualifies someone for these exams, about whether a trafficking experience qualifies for the exam if there was not like an assault from the trafficker or assault from the buyer in the near future. What do people need to understand about gaining access to sane exams and eligibility for access?
Yes, I can speak to that too. Certainly, there are things that we do in that exam that are time sensitive. So, if we're talking about maybe starting medication to prevent HIV infection, that is one thing that is just really science based, right? So, it does have to be started within 72 hours of your last contact that is concerning. That might be an option that we can't talk about in the same way. Doesn't necessarily mean we can't still talk about HIV and risks and other options for treating and testing. It just means that one particular topic is probably not going to be offered in the same way. Same with emergency contraception, right? There is a timeline with where that is effective in your body. Based on your state, a lot of crime labs have best practice as to when you want to do swabs. So in Wisconsin, they would say, unless there's extenuating circumstances, generally we want swabs collected within 96 hours, so 5 days. In Minnesota, it's longer. In some other states, it might vary as well. But again, not everybody is really, that's not their top priority, is the swabs or the HIV. So if they are wanting that experience, we never want anybody to feel like they're ineligible because of a time frame, right? Because there's so many reasons why somebody's not coming in right away. So we may have a discussion of what are your concerns? Is this an appropriate exam for you? And if their concern is just HIV medicine, then maybe it's not. Then maybe we give you that education and we set up an appointment with an HIV specialist or with somebody that can address that beyond the timeline. But for the most part, if they just want that compassionate exam, somebody to look at their body, somebody to tell them that they're okay, somebody that they feel comfortable talking to, we're not going to turn you down no matter what the timeline is.
Thank you, Melissa. Annalise or Amanda, do either of you want to add to that?
Just think to note that always connecting with that sexual assault advocate who maybe if the exam isn't necessarily within that time frame or the element of the exam we're outside of that time frame for that's most important to the survivor, still connecting them to the sexual assault advocate who can walk them through all of the choices that they have, support them in making any choices that feel best for them, and then helping them connect to that further medical care or that further support system is pretty critical because again we're at our core treating the sexual assault that occurred, the sexual violence that happened against the person, and then also co-advocating with human trafficking advocacy or forensic nursing or whatever our survivor needs in that moment, and they're identifying themselves.
Thank you. And I want to clarify one thing. So going back to the question around when someone can access an exam or what makes them eligible for accessing an exam. One thing that we had talked about that seemed like a misconception when we all talked before was that someone was only able to access or was only eligible for a sane exam if there was like a rape by force that happened either from their trafficker or from a buyer. But that's not true, right? Like sex trafficking specifically qualifies someone for a SANE exam, even if the sex trafficking was the assault and there was not a rape by force by a trafficker or buyer that happened during the trafficking. Correct?
Absolutely.
And I think that's a place where it gets missed. Go ahead, Amanda.
I think something too is to remember that we often think of the forensic exams as for sexual violence. And they also, these nurses are trained to work with individuals with a lot of different challenges. And Melissa, I'm going to let you go into that a little bit more because you can talk about that more eloquently. The only other thing I want to point out is this is why it's important to know your community, because every place that I have worked across the country, I have to get to know that community. I have to know, is their forensic team just providing services at the hospital? And are they only, because of the lack of resources in the area, are they only able to provide more of that crisis response? Or are they offering these services? And I think it's hard because sometimes when we're not crying out for those services, they go, we don't need any more in our community. And so we need to, as advocates and providers, be supporting bringing more forensic nursing staff on, more sexual assault advocates, and making sure that they have the training and the ability to provide the more expansive services that they offer, not just someone was assaulted, let's get them to the hospital right away, while also knowing and providing education for our human trafficking teams, what that looks like. Because I've seen that even in those emergency situations, I've seen people completely miss that they should take someone or at least offer someone a forensic exam. But Melissa, I would love for you to share a little bit more about that expansive, all the different type of services you offer to different populations.
Yeah, absolutely. And it's important to know your resources, like Amanda said, in your community, because there are places that are very strictly, we will only see within 3 days, we will only see within 5 days, we only see sexual assault, which should also include trafficking. Some see intimate partner violence. So fortunately, our nurses see strangulation victims, sexual assault victims, trafficking victims. I work for another organization right over in the Twin Cities, St. Paul, that sees intimate partner violence victims. And truly, being a victim of violence is never a straightforward, only one kind of victimization, right? We often see that there are multiple signs of victimization in that person. Strangulation and sexual assault tend to go hand in hand. Strangulation and human trafficking, sexual assault and trafficking go hand in hand. Intimate partner violence, it's a far more complex than being just a victim of one type of violence. So most of your forensic nurses should really be skilled and experts in that kind of compounded victimization and being able to make recommendations and educate and really treat that patient as a whole and not just very narrow focused on one type of victimization. And that really needs to include the screening questions to bring those types of victimizations out, not expecting that patient to voluntarily say, oh yeah, by the way, they put their hands around my throat. Are you asking questions? Did they put their hands around your throat? Did they obstruct your breathing in any other way? Or did they put pressure on your chest or suffocate you by covering your mouth and nose? So really making sure that we're addressing those kinds of questions and giving them an opportunity to bring those pieces of information forward so that we're treating them wholly and completely. And yeah, another thing Amanda said, also knowing your community and knowing what resources are out there. We're very fortunate at our organization to have 4 community-based sites, we call them. So we respond to a lot of different hospital sites, but we also have another location where we can see victims who may have an aversion to wanting to go to a hospital. And that could be for so many reasons. They could have prior bad experiences there. They could be maybe overwhelmed with the noises. They maybe don't feel like it's a confidential place for them. And especially when you're working in a rural community and even sometimes in a metro community, people. And I had a trafficking victim tell me once that they didn't want to go to a big metro hospital because they felt like they were being watched. And if they went there, their trafficker was going to know they were there. So being able to have different options of where that care can happen can be really a huge advantage as well.
Thank you so much, Melissa. Annalise, do you want to add anything else?
I was just going to say, because we do treat so many different things besides just sexual assault at its core, empowering survivors to know their own health care. Having a survivor hear from a nurse the risks of strangulation, what we should be looking out for, how to empower ourselves moving forward, and then even understanding the studies that are coming out about the impacts on the brain and the body moving forward once you've survived. I think it's critical that they hear that from a medical professional in a trauma-informed way, because it can be really shocking hearing it from somebody else. And as trauma informed as I can be as an advocate, it's still really important that survivors are taking those impacts on their brain and their body seriously and knowing where to ask those questions and how to get that follow-up care. And impacts like strangulation might be out of the hands of a survivor to control, but at least they're informed now. At least they're informed, and then when they're lucky enough to gain access to consistent medical care and what that looks like, they're able to inform their doctor, hey, I've experienced this and I'm worried about the impacts of it on my health, because I don't think we educate enough on that. Same with domestic violence and when people have autoimmunes and everything else because their nervous system's just so out of control all the time. So being informed and educated is really important moving forward.
Yeah, and I think I may have to look at incorporating a strangulation webinar this year because you all informed me. We had a little moment where I'm like, oh, I should probably try and figure some of this out for my own personal health and for the health of the survivors that I work with when we were talking about it in preparation for this webinar. And I think I'm grateful that the strangulation conversation is something that I have seen in more spaces in the last couple of years than I had ever before. So someone is doing a really great job, or a group of people are collectively doing an excellent job of bringing that conversation forward. But I think it is something that we in this platform are probably going to need to have a conversation around this year as well. I want to shift into some of the Q&A from our attendees as we draw nearer to the end of our time together. And You did answer this question earlier, Melissa, but I want to just give you the opportunity to share anything else that you might want to talk about. This question is saying that there might be a false understanding that sane exams need to happen within a certain number of hours after an act of sexual violence. Are there published guidelines somewhere that would help providers know when this type of appointment might be most appropriate?
Yeah, so that really is going to depend a lot on your specific state's crime lab, for one, if we're talking about evidence collection. For HIV medication, yes, we are absolutely very strict on the 72 hours within last exposure of contact. Emergency contraception, for the most part, is going to be within 5 days. Beyond that, it is going to be very program specific. So, reaching out to whatever your forensic nursing program is and having that conversation with them about when they would turn a patient away based on a time frame. As I mentioned, because we are a nonprofit and we're independent, we get to make those rules for our nurses and our patients, and we're really very flexible. So it really depends on what that patient is hoping to be addressed, and then in your region, what that program does.
Thank you so much. Go ahead, Amanda.
I just want to speak to the flip side of this, being that I've worked so long within the anti trafficking community. I don't think we always know what those timeframes are. When I talk to advocates, when I talk to providers, we don't always know that this survivor came back to programming and indicated that they may have been assaulted during the 3 days they were gone, or however many days, right? And often they're not being offered, would you like a forensic exam? And this is what that means. Because quite frankly, we don't always know what that means, right? And so that's where on our end, we need to do a better job of education around what does it really mean to provide services. And that's connecting with our friends who are, or hopefully becoming our friends and our colleagues who are our sane sexual assault advocates, and working with them and knowing who their teams are, right? And who their forensic nurses are, and connecting, and all of us getting together and working together in those spaces. And it's also us understanding that as human trafficking advocates, we need to be experts in sexual assault and intimate partner violence, domestic violence. Like, we don't have the privilege of it just being in a tiny box. We don't. And so us just acknowledging that and taking those steps forward to educate ourselves and asking those questions is imperative. And I've seen so many survivors not be offered services that they should have just because there was an intersection missed. It was missed, that intersectionality. And so I think that's really where my heart is in this, is there's more conversations to be had. Let this just be the beginning of that, and finding out what is really in your community.
I'm going to do a shameless plug here for this incredible resource that Amanda has spent the last year and a half, create 2 years, yeah, creating, that will launch through Safe House Project some point this year, called our advocate training. And she's been developing a 60-hour advocate training that, if you live in a state like I live in California, where we have specific guidelines around what qualifies you as a sexual assault, human trafficking, domestic violence advocate, which are the things that allow you to have confidential communication with a client, that allow you to go into exams with a client. If you live in a state like California, or many others that have these specific legislative guidelines around what qualifies you to hold that position, it fulfills that. She did so much research. It fulfills that qualification for every single state that has those in the US. And it is a phenomenal training, and goes over what happens in a SANE exam, what qualifies for that, and many other things, including all of the intersectionalities. So that is not what this webinar is about, but it has been hours upon hundreds of hours, hundreds and hundreds of hours that Amanda and some other team members that she's worked with have poured into that. So if this is something that you are interested in, keep on a lookout for that, which will come out later this year. Annalise, did you have something that you wanted to add?
I was just going to add her training. I have never
Yeah.
I've never felt more seen as a sexual assault advocate reading her training. She really and truly knows what she's talking about when it comes to sexual violence.
Yeah.
So just look it up. It's really cool.
Yeah. She's brilliant. And we're excited to get to host this incredible thing that she's created. Okay. So it's called the advocate training. I got a question of that. It's called the advocate training, and more information will come out from Safe House Project about that as time goes on this year. I think our hope is it will launch in March. Is that right, Amanda? That's the goal right now.
I think it'll be a little later than March,
A little later than
but we
March.
do have one coming out in March.
Oh, the ally training. Yeah. Just keep a lookout this year. So you gave a lot of choices of things that are available in SANE exams. Are those things available for adults only, or are those additional outside of forensic evidence collection resources available for minors as well?
Yeah, that's an excellent question. For the most part, adolescents and adults are treated as one entity within the forensic nursing world. So if it's available for adults, it's the same available for adolescents. Again, there might be some differences based on state law, but here in Wisconsin, adolescents get to make their own sexual health decisions. So we don't need a parent's permission to do a lot of the things that we do. Prepubescent or children who haven't reached puberty yet are a little bit differently handled. Some of their time frames are a little different, but essentially they have to assent to the entire exam. They have to be agreeable, they have to be cooperative. We are never going to force them to participate in any part of the exam. We may try different tactics and different rapport building strategies, but ultimately we are not going to assault them as a patient by forcing them to participate in any part of that exam. So if it's just not happening that day, it's just not happening. We could try another time, or it just doesn't work out that way. Nothing is so important that we are going to strap them down or hold them down and make them do it. Hopefully that answers that.
Yes, it absolutely answers that. Are they offered the same resources? Are minors offered the same resources as far as education, saying
Yes.
no to evidence? You said, yeah, you're not going to force, but
Yes,
yeah.
absolutely. So even if it's a circumstance, you've got a 13-year-old and they really don't want to be there, right? So again, it's going to be our primary concern to list out, here are things that we can talk about, here are things that we can do, but what do you want out of this? And listening and making sure that is addressed with them. I would say probably the majority of the time when we're dealing with adolescents, we are doing a lot of education, a lot of explaining things, maybe explaining how different laws work, giving them options, saying, here are things, I'm a mandated reporter for you if you're 13. So only tell me what you want to tell me. We have an advocate here who is completely confidential. If there are things that I need to step out of the room for and you can have that conversation with the advocate, absolutely go right ahead. Here's the things that I would have to report. Making sure that they know those things up front is extremely important. But yes, there are a little bit of differences based on age and based on your state and kind of some of your statutes. So try and get familiar with those. Your advocacy agencies should be familiar with them already. So reaching out to them and having that collaborative conversation. But ultimately, no matter what the age is, they should not be forced to participate in any part of an exam.
Yeah, and as far as advocacy care, it's the same. I think the only limitation I ever experience is getting adolescents to me, right? If they're unable to drive and they don't want to disclose to parents that they're working with us because we're confidential, it's navigating how do we connect and what does that look like, and providing that supportive care or encouraging, hey, let's have this conversation with parents. And so we can really build that safety net of support. So it's state by state, but they're able to get all the same care, young or old, with advocacy as well.
Great. Thank you. Then we have a couple of questions around the standard of trauma-informed care and how that may vary. So the questions have been asking, like, is this consistent across all centers? Basically that question has come up multiple times. And I'm going to go out on a limb and say probably not consistent across all standards because of financial restraints, because of the amount of people that are available to cover a certain area. One is that true? And two, if somebody, I'm going to ask an additional question. If somebody lives in an area that doesn't have this standard of care, what could they do to advocate for this? And are there trainings that that you would recommend they point their sane nurses or sane centers to get them on board with getting to this level of care?
Yes, you're absolutely right. The options for different programs vary, whether it's rural and lack of nurses, whether it's just lack of training, lack of resources, lack of advocacy to work with those nurses. Unfortunately, it can look a little bit differently based on each program. It is a standard for education that each nurse does have this trauma informed education or this piece to our education. If you are in a community where you find that's not quite where it should be, or there aren't nurses and you're wanting to get nurses involved and trained, you can reach out to what's called the International Association of Forensic Nurses. It is an organization that sets education standards. They offer online training. They offer a lot of ongoing education, webinars, other things like that, that unfortunately the organization is going through some difficulties and has pulled back some of our services, but they are still offering that education. There is a fee to it, so sometimes that can be a challenge, but it is, at this point anyways, probably the gold standard for educating forensic nurses. There is another agency called Academy of Forensic Nurses. They are national as well, and they provide a lot of ongoing training, a lot of online opportunities. There is the Institute of Prevention of Strangulation. They offer great strangulation trainings. There is End Violence Against Women International. They're heavily law enforcement focused, but they also have trainings that are pertinent to forensic nurses as well, and oftentimes free. So there are resources out there. Also, the National Institute, National Justice Institute, is that what it's called, Annalise? Yes. Sorry, I forgot. There's a training out there by Rebecca Campbell that is incredible. There are resources out there by Jackie Campbell for intimate partner violence and strangulation that are incredible. Yeah, if you work with your advocacy agencies, they also know about a lot of these trainings and opportunities and have probably also worked really hard to get more trauma informed care in their community. So using them as a resource too.
Thank you so much. And I've written some of those down so I can
Yeah.
look into them as well. And Brandy, yes, I will pull the transcript from this and pull out all of those resources and send them out when I send out the email next week. I want to ask one more question just because, again, it has come up multiple times. That is around the cost of SANE exams and how usually if the purpose of the SANE exam was for evidence collection, the cost is covered by victims comp or whomever in the state is covering those. If the victim reports to law enforcement. If they don't report to law enforcement, who's responsible for payment of that service?
Yes. Okay. Excellent question. I'll weigh in first, and then I'm sure that Amanda and Annalise have something to add. The victim should never be responsible for paying for that exam. It should always be free to the victim. There are some caveats. I know in the state of Wisconsin, Wisconsin Safe Fund is what we call, doesn't reimburse for emergency contraception. Most of the hospitals in the state will write that cost off because there is legislation that says that they have to offer it, whether they're a religious hospital or not. So it really should never be the responsibility of the patient. A lot of hospitals, if it's a hospital-based program, will have to eat a lot of the cost of the exam, and it is not a money maker for a hospital. And so that is often a problem when we're talking about why aren't there more forensic nurses or more SANE programs out there. Some hospitals really don't see beyond the dollar signs as far as why they aren't offering it or why they're not offering it. But yes, it should not be a responsibility of the patient. Our program, the exams are completely free to the patient, and really legislatively, they should always be.
Yeah. So there's model legislation out there that can support this, right? So if that's something that you are interested in bringing to your state, we can look that up and we can figure out what that model legislation is and how it would apply to the mandates or the policies that you need in your state. I'm going to kind of close us out because we are at time. Next month, we're going to be talking about labor trafficking by forced criminality, which is another topic that it's honestly just really important and understudied and under recognized. So I'm excited about that. Hopeful that many of you will be able to join us. I'll be sending out an invite email, but I just want to take a moment to say thank you to our panelists for sharing their expertise, for being on here. Thank you to you all for taking an hour out of your Friday to come and sit with us and learn and be a part of this conversation. And I will send out Amanda's information and the information for the St. Croix Valley SART as well if you want to get in touch with them and have more conversations about this topic. And we hope to talk to you more. Great to be on with you again. And thank you again, Amanda, Melissa, and Annalise for sharing your expertise.